Bismillahirrahmanirrahim. These videos are basically to help you understand what is written in the text. The first video is going to be an overview on the about the general diseases of kidney, and step by step we'll move further. For example, if this is a kidney, this is the cortex, this is the medulla, pelvic ileal system, and we'll study glomerular diseases, then the cortical diseases or pyelonephritis, tubulointerstitial nephritis, and then nephrosclerosis, which are basically the diseases of the vessels which are entering the kidney from the medulla. So this is basically general. The first video is on the general aspects of renal diseases. So what happens in the renal diseases? We have two main components of the kidney. One component is cortex, one component is medulla. Cortex primarily has numerous glomeruli, ठीक है, और glomeruli से tubules they extend and they go down into the cortex, and then they drain into the pelvic ileal system from and then the urine goes from the ureter into the urinary bladder. So by the common sense we know the diseases which will primarily involve the interstitium, they'll affect the tubules, while the diseases which will primarily affect the cortex of kidney, they'll affect the glomeruli. Okay, so renal cortical diseases primarily affect glomeruli, while renal medullary lesions primarily affect tubules. Now, renal cortical diseases or glomerular diseases are very vast. We'll start with the shorter topics first, such as acute pyelonephritis and nephrosclerosis, and then we'll move towards the larger topic, that is renal glomerular diseases. So we'll first of all understand what are the basic pathogenic mechanisms that lead to renal diseases. Different mechanisms lead to involvement of various components of the kidney. So there are four main components of the kidney that you should know: glomeruli, tubules, interstitium, and vessels. Always remember these four entities or these four structures will be involved in glomerular diseases. When we say the main heading, these four structures will be involved in the renal diseases. When we say glomerular diseases, this component is the this structure is the main component that is involved. And when we say tubular or acute pyelonephritis, for example, then this is the main structure that is involved. And say along with the tubules, interstitium is also involved in acute pyelonephritis. Then if we say there is some sort of ischemic change or vasculitis or obstructive cause of the vessel which lead to renal damage, then this is the main component that will be involved. Each component you'll see in your textbook is written under different heading. For example, glomerular diseases, tubulointerstitial diseases, and vascular disease. And then there comes a heading of renal tumors. Renal glomerular diseases, this is a vast topic, so we'll cover it in the end. First, start off with the shorter topics to have a better understanding, and let us just orient the way the video goes. So our main focus in second and third video will be on tubules and interstitium and diseases which involve these two components. So we'll start off with what is acute pyelonephritis. Acute means rapid in onset, pyelo means pelvic ileal system, and nephritis means inflammation. So this is basically inflammation of pelvic ileal system, and this is the pelvic ileal system. As I already told you that this disease primarily involves this part, that is renal medulla. And this part mainly contains what? Tubules and interstitium. So in the morphology of acute pyelonephritis, we are going to talk about only these two components. We won't be talking about glomeruli or vessels. So why does acute pyelonephritis happen? How can a patient present to you? So the patient will come with a triad of flank pain, which is a very vague symptom, and it can occur in renal stones, tumor, and multiple disorders. So flank pain, then second, fever. Combination of these two is very important to suspect acute pyelonephritis, because fever is a symptom which shows infection. In acute pyelonephritis, inflammation of the pelvic ileal system is due to infection. So flank pain, fever, most important symptom, that is fever, and hematuria, which can, or plus minus, which can, but these two are the main symptoms which occur in acute pyelonephritis. A patient which comes to you, for example, middle-aged patient with a long-standing history of repeated urinary tract infections, comes now with the complaint of flank pain and fever. What you should suspect? You should suspect that the urinary tract infection has ascended and it has infected pelvic ileal system. And this is basically acute pyelonephritis. So through common sense, now we can guess what the morphology will be. Morphology will be tubular inflammation and interstitial inflammation. It is as simple as that. So in morphology, you will see in the books there are few words such as interstitial, abscess, tubulitis. Tubulitis is what basically? It is entry of neutrophils in the tubular epithelium. Tubular neutrophilic abscesses. And then secondarily, when this system is disrupted, there will be, even if glomeruli were normal initially, there won't be a flow of urine ahead into the medulla, and this will lead to the secondarily it will affect glomeruli and vessels as well. So in morphology, there will be interstitial abscess, tubulitis, and tubular neutrophilic abscesses in the morphology of acute pyelonephritis. And what can be the complications of acute pyelonephritis? Complications में आपने 3 P's याद रखने. What are these 3 P's? These are basically papillary necrosis. Now, what is papillary necrosis? Papillary necrosis, these are renal pyramids, okay? And this part is renal papilla. This, in acute pyelonephritis, this undergoes necrosis. And as you know from the general pathology concept, that kidney undergoes coagulative necrosis. So in morphology, what we'll see in the complication of acute pyelonephritis, we'll see papillary necrosis, which will comprise of coagulative necrosis of the renal parenchyma. Then pyonephrosis. As the name indicates, pyo means pus, nephrosis means in the kidney. When there will be obstruction, as acute pyelonephritis usually occurs as a result of obstruction, so it will lead to pus formation in this region. Pus has to drain into the bladder and then into the urethra and go out in the urine. But when there is obstruction in this region, it will accumulate in the pelvic ileal system, and this is known as pyonephrosis. Then we have perinephric abscess. What is perinephric abscess? This pus now has to go out of the kidney. It cannot go down. It has stayed here for a while and it is accumulating. So it will start sprinkling into the perinephric fat. So this is basically perinephric abscess formation. A quick review. What is acute pyelonephritis? It is the inflammation of the pelvic ileal system or tubulointerstitium. What causes this? Main cause is basically repeated urinary tract infection. how these infections usually occur? These can occur via stasis. कॉजेज में आप ये कह सकते हैं स्टेसिस किन कंडीशंस में हो जाता है? न्यूरोलॉजिकल कंडीशंस हैं, प्रेगनेंसी है, ऑब्स्ट्रक्शन है, तो स्टेसिस. व्हेन यूरिन विल स्टे इन द ब्लैडर फॉर अ लॉन्ग ड्यूरेशन ऑफ टाइम, द vesico-ureteric junction, it becomes incompetent. So this will lead to vesico-ureteric reflux. That is reflux of the urine back in the ureter. This is vesico-ureteric reflux. This can be congenital or acquired. This reflux will lead to the entry of urine into the ureter and then back into the pelvic ileal system. So the infection that was residing over here, these bacteria, these angry looking bacteria, they love to go up and infect the kidney if they can't go down. So this is the main mechanism which affects acute pyelonephritis. How did this happen? Now how did the patient come to you? The patient came to you with the main complaint of flagging pain and fever, along with plus minus hematuria. Fever is the main component in the history of a patient that has repeated urinary tract infections. When he develops fever and flank pain, you should suspect acute pyelonephritis. Now you took a renal biopsy, and in the biopsy, what did you see? Basically, this is pelvic ileal system disease, so you will have to mention the pathologic mechanism in the tubules and interstitium. There was interstitial abscess formation, tubulitis, and intratubular, that is neutrophils within the lumen of tubules. Intratubular neutrophilic abscesses. What was the complication of acute pyelonephritis? 3 P's. Papilla underwent necrosis, coagulative necrosis. Pus was formed. This is pyelonephrosis. Pus trickled into the perinephric fat. This is perinephric abscess formation. So this is basically the whole concept behind acute pyelonephritis. Now chronic pyelonephritis. We initially studied what was acute pyelonephritis. Now we are going towards the chronic stage, that is chronic pyelonephritis. As you all know, whenever something ends up in chronic state, there has to be fibrosis, removal of the neutrophils from that position, and replacement of the neutrophils by lymphocytes. These are the key mechanisms that happen in the chronic conditions of almost every organ, whether it is stomach, whether it is bladder, anywhere. Whenever the chronic inflammation occurs, there has to be fibrosis. So, chronic pyelonephritis, first of all, what are the causes that can lead to chronic pyelonephritis? The causes are basically related to what led to acute pyelonephritis, and these are vesico-ureteric reflux, which can be congenital or acquired. Acquired is usually because of the obstructive conditions, and in congenital cases, children present with the picture of chronic pyelonephritis or history of acute pyelonephritis, and then ending up with the deranged RFTs and chronic pyelonephritis. This is basically close to end-stage renal disease. So one was vesico-ureteric reflux, and second was chronic obstructive pyelonephritis. This is basically acute pyelonephritis due to chronic obstruction, and due to persistence of the obstruction, it ended up in the chronic state. What happens in the chronic state? We studied in acute that there was necrosis of the papilla. When the necrosis occurs, it has to be replaced by fibrosis. So those papillas will be replaced by the fibrotic band, and the calyces will be dilated and irregular in shape in those areas. Dilation and irregular shape of the pelvic ileal system is a main clue that patient has chronic pyelonephritis. In other chronic tubulointerstitial diseases, this change does not occur. It has to be a change that occurs in chronic pyelonephritis. Why? Because it is the sequelae of acute condition which distorts the renal papillae. Other chronic tubular interstitial diseases do not lead to this change. So it is a hallmark, let's say. What will you see in the morphology? As I just mentioned, you will see interstitial fibrosis. The two main components of the pelvic calyceal region or medullary region are interstitium and tubules and vessels. Main are the interstitium and tubules. So interstitial fibrosis and tubular atrophy, that is the normal sized tubules shrunk down into the small sized tubules, and few underwent dilation and lining by atrophic epithelium. Why this dilation occurred? Because they had casts and this cast in the microscopy looks like colloid of the thyroid. This is also known as thyroidization of the tubules. And as this fibrosis progressed from the medullary region into the cortex, so there was the loss of the glomeruli in this region. First change was interstitial fibrosis, second change was tubular atrophy, third change was associated tubular dilation and thyroidization. This is tubular dilation and thyroidization. And then fourth change was loss of glomeruli. Loss of glomeruli means this patient cannot filter the blood, all the filtration mechanism is lost, and he'll have raised serum creatinine level, deranged RFTs, and this will progress to end-stage renal diseases needing the dialysis and renal transplant. So this is basically all about acute pyelonephritis and chronic pyelonephritis. So this is all for the topic of acute pyelonephritis and chronic pyelonephritis. I would like you to receive a take-home message, and this is basically what you need to know most importantly from this topic. First, morphology of APN, acute pyelonephritis. In morphology, you should know if somebody asks you what is seen in the biopsy of acute pyelonephritis. Common sense should help you. It is a disease of tubules and interstitium, so there has to be inflammation of interstitium and tubules. So interstitial abscesses, tubulitis, tubular neutrophilic abscesses, this is the morphology of APN. What are the complications? First, the renal papilla underwent necrosis, then the pus was accumulated and perinephric abscess. What are the causes? Causes are basically few, which are infection is the most common cause, which ascends from the bladder. Rarely it comes from the blood. What leads to this infection ascending into the kidney? Most commonly obstruction of the renal system, and obstruction can be due to stone or any other cause. And another feature that helps in this reflux of the infection or ascent of this infection is vesico-ureteric reflux. This basically vesico-ureteric reflux occurs both in acute and chronic pyelonephritis. Basically, chronic patients usually have this vesico-ureteric reflux, and this is all about it.